Welcoming a new baby into the world is one of life's most profound and transformative experiences. The days and weeks following delivery are filled with joy, new beginnings, and quite often, a host of unexpected challenges as your body and mind adjust to this incredible change. Whether you've given birth vaginally or via cesarean section, postpartum recovery is a journey that deserves care, patience, and support. Drawing on the expertise of a Women's Health PAC or Physician Assistant Certified, let's explore practical, compassionate advice to help you recover, heal, and thrive during the postpartum period. The first thing to remember is that every woman's postpartum experience is unique. Your recovery timeline, symptoms, and needs may look different from someone else's, and that's completely normal. The postpartum period, often referred to as the fourth trimester, generally encompasses the first 6 weeks after delivery, but healing and adjustments can extend well beyond that. This time is about physical recovery, emotional adaptation, and learning how to care for your newborn and yourself. In the immediate hours and days after delivery, your body is in a state of transition. Your uterus, which expanded to accommodate your growing baby, begins the process of involution, shrinking back down to its pre-pregnancy size. This can cause cramping, often referred to as after pains, which are particularly noticeable during breastfeeding due to the natural release of oxytocin. It's normal to experience vaginal bleeding, known as lochia, which can last for several weeks. This is your body's way of shedding the extra blood and tissue that supported your pregnancy. One of the most important things you can do in those early days is to rest as much as possible. This may sound easier said than done with a newborn needing round-the-clock care, but even short naps and periods of quiet can make a difference. Enlist help from family, friends, or your partner so you can take breaks to sleep, shower, and recharge. Remember, your body has just undergone an immense physical event. Rest is not a luxury, it's a necessity. Pain management is another key aspect of postpartum recovery. If you've had a vaginal delivery, you may experience soreness, swelling, or even stitches from a tear or episiotomy. Using a peri bottle to rinse with warm water after using the bathroom can help keep the area clean and reduce discomfort. Cold packs, witch hazel pads, and sitz baths are commonly recommended for soothing perineal pain. Over-the-counter pain relievers like acetaminophen or ibuprofen are typically safe, but it's always best to consult your healthcare provider, especially if you're breastfeeding. For those who've had a cesarean section, recovery involves caring for your incision site as well as your overall health. Keep the incision clean and dry, and watch for signs of infection, such as redness, swelling, or discharge. Avoid heavy lifting and strenuous activity for at least 6 weeks, or as directed by your provider. Gentle movement, like short walks, can aid circulation and promote healing. But listen to your body and don't push yourself too hard. Regardless of your delivery method, bowel movements can be a source of anxiety after childbirth. Hormonal changes, pain medications, and the physical strain of delivery can all contribute to constipation. Stay hydrated, eat fiber-rich foods, and consider gentle stool softeners if recommended by your provider. Don't ignore the urge to go, and take your time. Your body is still adjusting. Pelvic floor health is another essential part of postpartum recovery. Pregnancy and delivery stretch and sometimes weaken the pelvic floor muscles, which support the bladder, uterus, and rectum. This can lead to symptoms such as urinary incontinence or a feeling of heaviness in the pelvic area. Gentle pelvic floor exercises, commonly known as Kegels, can help rebuild strength and function. A women's health physical therapist can be a valuable resource if you're experiencing significant discomfort or concerns. Breast changes are another common part of the postpartum journey. Whether you choose to breastfeed or not, your breasts will likely feel fuller, heavier, and sometimes tender as your milk comes in. If you're breastfeeding, ensure a good latch to prevent nipple soreness and use lanolin or other nipple creams for relief if needed. If you're not breastfeeding, supportive bras and cold compresses can help with discomfort as your milk supply decreases. Emotional health is just as important as physical recovery. The the hormonal roller coaster after childbirth can lead to a range of emotions, from elation to anxiety to weepiness. The baby blues are common and typically resolve within 2 weeks. However, if feelings of sadness, hopelessness, or overwhelm persist, or if you're struggling to care for yourself or your baby, it's crucial to reach out for help. Postpartum depression and anxiety are real, treatable conditions. There is no shame in seeking support from your healthcare provider or a mental health professional. Nutrition and hydration play a fundamental role in recovery. Your body needs extra energy and nutrients to heal, and, if you're breastfeeding, to produce milk. Focus on balanced meals that include lean proteins, whole grains, fruits, vegetables, and healthy fats. Keep a water bottle handy and sip throughout the day to stay hydrated. Don't be afraid to ask loved ones to help with meal preparation or bring nourishing snacks. Physical activity can gradually be reintroduced as you feel ready and with your provider's guidance. Light walking is a great way to boost mood, improve circulation, and gently ease your body back into movement. Avoid high-impact exercise, heavy lifting, or abdominal workouts until cleared by your provider, typically at the 6-week checkup. Sleep will likely be in short supply during the newborn phase, but prioritizing rest wherever possible is vital. Nap when your baby naps, even if just for a few minutes at a time. Accept help with household chores, and don't worry about keeping up with everything you did before baby arrived. Your primary job right now is to heal and care for yourself and your child. Social support is a cornerstone of postpartum wellness. Connect with other new parents through support groups, online forums, or local community organizations. Sharing experiences, concerns, and victories with others who understand can be incredibly validating and helpful. Don't hesitate to communicate openly with your partner, family, and friends about your needs. Whether it's help with baby care, a listening ear, or simply some company during long days and nights, follow-up care with your healthcare provider is essential, even if you feel well. The postpartum checkup, usually scheduled about 6 weeks after delivery, is an opportunity to discuss healing, contraception, mental health, and any lingering symptoms. Be honest about how you're feeling, both physically and emotionally. Your provider is there to support you and address any questions or concerns. If you notice any signs of complications, don't hesitate to seek medical attention. Warning signs include heavy bleeding, soaking through more than 1 pad an hour, severe abdominal pain, fever, foul-smelling discharge, red or swollen legs, chest pain, or difficulty breathing. These could indicate serious conditions like infection or blood clots that require prompt care. Sexual health is another facet of postpartum recovery. It's normal to have a decrease in libido after childbirth due to hormonal changes, fatigue, and healing. Most providers recommend waiting until after your 6-week checkup before resuming sexual activity. But timing varies for everyone. Communicate openly with your partner, use lubrication as needed, and take things slowly. Returning to work or regular routines can bring its own set of challenges. Give yourself grace as you adjust, and seek out resources like lactation consultants, childcare support, or flexible work arrangements if possible. Balancing the demands of parenthood and other responsibilities takes time and patience. Ultimately, postpartum recovery is not about bouncing back to your pre-pregnancy self. It's about moving forward into a new phase of life, with all its joys and challenges. Be gentle with yourself, celebrate small milestones, and remember that healing is a process. You've accomplished something incredible, and you deserve care, support, and compassion. If you ever feel overwhelmed or unsure, reach out to your healthcare provider, a trusted friend, or a support group. You're not alone on this journey, and with time, patience, and the right resources, you'll find your strength and confidence as a new parent.